Hi guys, my name is Dr. Stacey Fuller and I'm with NWI Chiropractic. We're here today in our Valparaiso office to discuss what a diastasis recti is and how we can treat it. So a diastasis recti is right over here where your six-pack abs kind of come together. There's a little bit of tissue, and when we have different conditions such as pregnancy, those tissues can kind of split apart and we'll get a little bulging here. Now, like I mentioned earlier, this happens a lot with pregnancy. Most women are not aware of it during their pregnancy because they're growing and they're not noticing the change. So post-pregnancy is when a lot of women will discover that they have this. So one easy way to check for it is kind of lay like this, go to lift up, and if you have a little bulge, almost like there's a hot dog under your skin here, then that means that you have a little bit of a diastasis recti. So those muscles have just pulled apart a little bit, allowing the air pressure in your stomach to kind of bulge out that little frayed tissue. Now, this is a problem because, as we know, we need our core stability to help with our low back, to help stabilize us for functional movement in life. So when we get a little bulge there, it's like having a bald spot in your tire. So you don't want a bald spot in your tire. So one way that we can treat this, which we do here in our office every day, for pregnant women, postpartum women, and even men, sometimes men get this too, you're going to do what we have in DNS, is called a 7-month position. So you're going to kind of lay on your side, your leg's going to be a little bit bent, elbow is going to be under the shoulder, and nice and easy, you're going to pretend that there's a string pulling you up and forward. So you're going to come up like this, and you just hold it. So you're careful not to be twisting. So we don't want our shoulder twisted or our hips twisted. Everything should be in a nice straight line, holding tight here so that we're really working those oblique muscles. So we want to get the oblique muscles working so that that rectus abdominis can kind of come back together and heal nicely. So you just want to hold it for a few seconds, kind of breathing into your belly the whole time, and then bridge back down nice and safe. So if you think that you have a diastasis recti, or you're thinking that you want to prevent one, if you're thinking about getting pregnant, come on into our office and we can get you some good tools to work on that.